Okay, so let's move on now lastly to the actual biological interventions, biological therapies. So most commonly, we're not going to spend a lot of time here, just medication, pills. Specific drugs are often used to treat specific disorders. We're going to get into that more when we talk about specific disorders. So hang tight. There's also phototherapy. Phototherapy involves showing repeated exposure of bright light, so kind of simulating what the sun would look like. And it's often used to treat depression, seasonal affective disorder, seasonal depression when you don't have as much sun going on outside. Maybe you feel yourself, it's hard to get out of bed, or you kind of feel a little bit more depressed in the winter months. Phototherapy can help you out. I ended up getting one myself when I moved here to Columbus because compared to California, y'all have no sun here. So this is what this looks like. You just kind of show similar sun-like light. On the flip side, something that is less advised is psychosurgery, which is as scary as it sounds. It involves surgical destruction of certain brain areas. Luckily, this doesn't really happen as much today, but you should know that this existed. So different examples of this might be a hemispherectomy, which is, ectomy means like cutting out, and hemisphere is part of your brain. So this would mean cutting out half your brain. Or a cingulotomy, which is cutting out your cingulate cortex. Apparently that was used to treat OCD back in the days, but it is highly controversial of a practice. For instance, lobotomy used to be a thing where specifically the transorbital lobotomy, orbital meaning eye, doctors used to insert an instrument through a person's eye socket and then just kind of like dig around, drill some holes maybe into the frontal lobe. The objective, they thought, was to maybe sever some connections maybe between the frontal lobes and inner brain emotional structures. But also, like, I'm glad hopefully you're as disgusted as I am by this, that there's no way that you can't just dig around in someone's brain and expect that to go okay. Thankfully today, though, psychosurgery is pretty rare as far as therapies go. A little bit more common are things like brain stimulation. So this can come in two different forms. Deep brain stimulation, as the name implies, is deep in your brain. So this is electrical stimulation, and it is applied through actually surgically implanted electrodes. So this is pretty common to treat things like OCD and depression. If you stimulate things like the nucleus accumbens, which you'll remember Nicholas getting his bends is a reward pleasant kind of circuit. So if you stimulate those areas, it might help you improve your mood. I believe this is also used in like Parkinson's disease or other kind of physical disorder, neurological disorders as well. But what it looks like is you actually physically implant an electrode deep into someone's brain. And so you're able to control, using a device on the outside, electrical stimulations to a particular brain region of interest. But if you don't want to, surgically implant something inside someone's brain, you can also use TMS. So we talked about TMS a couple times now throughout this class, the transcranial magnetic stimulation. So I showed you the video and research methods of, or in some chapter, of Nancy Camisher, who was getting her motor cortex TMS'd and her arm was twitching. So this is when you place a powerful magnet instead, and not in the brain, but it's over the scalp, so it's non-invasive. And it's altering your neuronal activity. So it might be inhibiting or promoting certain neuron communication. So again, what that looks like, you saw a video of it occur earlier, but it's this giant kind of like double O-shaped magnet, and it sends magnetic pulses into the brain, and it then activates certain regions. Also used to treat depression as well. So you might, for instance, place your magnet kind of above your eyebrow to try to stimulate your prefrontal cortex, which is implicated in a variety of depression symptoms. Okay, if you're not feeling stimulation, you could also use electroconvulsive therapy, or ECT, which involves actually inducing a mild seizure in someone's brain. It delivers an electrical shock to someone's brain for less than a second. So although it has the side effect of short-term memory, apparently when individuals have ECT done, they don't remember that they had it done. So they don't have any memory of the experience, even if it was a painful experience. They just know that they feel better because of it. So this is probably one of the most controversial treatments because you're inducing a mild seizure. But it's pretty supported by the people who have successfully gone through it because they don't remember that they went through it. They just remember that they got better. So electroconvulsive shock therapy. This is what that looks like. So they put these giant kind of rods on various parts of your brain, and they just turn up the electricity to kind of stimulate that brain region more. We know that so much activity and a lot of fast active waves, brain waves, elicit seizures. So they're basically just trying to really amp up your brain waves to induce a seizure. Lastly, non-invasive instead. I'm basically showing you weird treatments and then like better treatments. There's a really cool thing called neurofeedback. So this is when you are teaching someone a particular behavior by typically putting them in an MRI machine or having them wear an EEG cap. So measuring electrical activity or blood flow, brain activation. Except typically when we do those types of experiments, we collect the data and then we analyze it later as researchers. With neurofeedback though, you literally are getting real-time results and you're showing the patient, or maybe you yourself are looking at the results as they're coming in. So the reason that this helps is you're able to say like, oh, you're really activating your amygdala a lot. Keep focusing on that. Or maybe try a different strategy so that we reduce that. Oh, that's working more. Yes. So you're able to see in real time how their brains are activating so you can get the patient to figure out exactly what system works for them. So they get a feel for exactly how to make their brain do a thing. It's often, I guess, used to treat ADHD, maybe if it works, question mark, and seizures, apparently too. I might show you a video of this either on the homepage of Carmen or down below because neurofeedback's pretty cool. And that's what this looks like. So again, you have your researcher sitting here. This is the individual. This is an EEG version of it. So they have electrodes on their scalp. So as the data is coming in and amplified to the computer, the researcher is able to see a different activation or what they're looking for. And in which case they're able to give feedback through programming or whatnot to their computer and show participants what it looks like, or give participants feedback of like, you did good, or like keep it up, or try something else, or whatever. So these are overall the different biological therapies you might use.